Good afternoon, everyone, and welcome to ONC's presentation on our interim final rule titled Information Blocking in the ONC Health IT Certification Program, Extension of Compliance Dates and Timeframes in Response to the COVID-19 Public Health Emergency. I am Michael Lipinski. I'm the Director of the Regulatory and Public Affairs Division, and I'm joined today by my colleagues Kate Tipping, who's Branch Chief of the Development Branch within the Regulatory and Policy Affairs Division, and Rob Anthony, who's the Director of the Certification Testing Division, which is in the Office of Technology. So today I will give you a quick intro on the rule, and then I'm going to turn it over to Kate, who will talk to you about the information blocking extension, as well as some related corrections for the information blocking regulation. And then Rob's going to talk to you about all the various states related to the certification program that have been extended through this interim final rule. And then at the end, they're going to turn back to me, and I will talk to you a little bit about, in summary, and some of the resources that we have available. So let's jump in. I think that's given us enough time for a few more of our friends to join us now. And let's move to the next slide. So as always, our disclaimer, which essentially says here that go to the rule for the official provisions and interpretation of those provisions. We're going to do our best here today to provide you an accurate restatement of those provisions. But again, this presentation is obviously not the legal document which we'll publish in the Federal Register. Let's move to the next slide. So this is a reminder of the Cures Act final rule, which we first put out in March of this year, and then it went published in May of this year, and then became effective, some of the provisions in June of this year. It may seem like a long time ago because of the public health emergency, but this serves as a good opportunity to remind you of the key provisions in that rule that we believe will help the entire healthcare system, and particularly patients and providers. So for patients, obviously, there's their ability to get their information in a more usable way. So getting their electronic health information through APIs, which are supported both through information blocking and the API requirements in the certification program. This will also make it easier through interoperability for doctors to have a better choice of the EHR technology that they get by making the EHR technology more interoperable. And we have the data export functionality that's in the rule that will help for doctors and hospitals if they were looking to transition to a new system. And obviously, through this interoperability and the patient matching features of the US CDI, which is US Core Data for Interoperability Standard, will help to improve patient safety. And then for developers, I think this will be good for them, obviously, in terms of standardizing the API, which will help with maintenance costs. And it also does it in a way that both through information blocking and the certification program that protects their intellectual property, the investments they've made in that technology. And obviously, again, by getting this information out of the system, not only does it help the patients from the perspective of transparency, but they'll be able to use that information in the shop for care. It also should improve innovation or spur new technologies, such as third-party apps that will provide providers options in terms of, for example, data analytics or population health to connect to their systems, as well as for patients, again, choice of different apps that can use the information that's in their record to provide them better ways for care or to shop for other care. So let's go now to the next slide and talk about the discrete purpose of this rule, this interim final rule. So originally, after we published our rule, as I told you back in May, and this was, excuse me, I should say when we first released our rule in March, we then issued what is known as enforcement discretion uh, for our rule because of the COVID-19 pandemic, which said, but that only applied to the certification program, and it stated that we would give a 3-month window in which for compliance. So no longer would developers have to comply on the date specified in the rule. They would have 3 more months in which to reach compliance. Moving on to the next slide. Okay. So now this interim final rule, which we announced last week on Thursday, we are officially extending the compliance dates for that certification program, but also for information blocking. So what a rulemaking allows us to do will allow us to move the information blocking date, which was enforcement lies for certain actors such as providers in health information networks and health information exchanges, as well as developers, so with the HHS Office of Inspector General. So a regulation was needed to move the date. And then let's move. So the one thing I want to say quickly before I turn this over to my colleagues, the rule itself now is available on the Federal Register's website for public inspection. So that's a PDF of the rule that we posted on our website, and then it will go to the tri-column format for actual publication in the Federal Register on Wednesday, November 4th, for your awareness. So you'll be able to find the rule there now, and then published this Wednesday. So at this point, as I mentioned earlier, I'm going to turn it over to my colleague, Kate Tipping, to talk to you about the information blocking provisions in this interim final rule. Kate?
Thanks, Mike. So next slide. So for information blocking, I'll just give an overview of what the compliance date extensions are. So who needs to be aware of these extensions? These are the actors that are subject to the information blocking provisions. And to what do the compliance dates apply to? So it's the applicability date of the information blocking provisions. But because we are extending the applicability date generally, we are also extending the dates for which the electronic health information is limited to the data elements represented in the US CDI. And that's in both the information blocking definition and, and the content and manner exception. And to when, so for the information blocking applicability date, that is being extended from today, November 2nd, 2020 to April 5th, 2021. And then the date upon which EHI may be limited to the data elements represented in the US CDI, that's being extended to October 6th, 2022. Next slide. So just a review. So who are the actors covered by information blocking? That includes healthcare providers, health IT developers of certified health IT, and health information networks and health information exchanges. And if you need to know if you are a covered actor, please review some of the fact sheets we have under the resources tab on our website at healthit.gov/cures rule. Next slide. And as I mentioned, the interim final rule moves the applicability date from November 2nd to April 5th, 2021. So this means that actors will now be subject to the information blocking provisions beginning on April 5th, 2021. Next. And because we extended the applicability date for 45 CFR Part 171, the information blocking provisions generally, as I mentioned, we're also extending the date upon which the period of time for which EHI is limited to the data elements represented in the US CDI. And so that's for the period before October 6, 2022. So that would be from April 5th, 2021 until October 5th, 2022. And then likewise, in the content and manner exception, to be consistent what we had in the ONC Cures Act final rule and to allow for the first 18 months after the applicability date, we also revised the dates that for the period before October 6, 2022, an actor must respond to a request to access, exchange, or use EHI with, at a minimum, the EHI identified by the data elements represented in the US CDI. And then on and after October 6, 2022, the actor must respond using the EHI as defined in section 171.102. Next slide. And actors that are subject to the information blocking provisions may be investigated by the HHS Office of Inspector General if they're subject to a claim of information blocking. So for actors found to have committed information blocking are subject to the penalties here. And so for health IT, developers of certified health IT and health information networks and exchanges, it's civil monetary penalties up to $1 million per violation. And for healthcare providers, it would be appropriate disincentives to be established by the Secretary. Next slide. And here we have an overview timeline slide of the dates for information blocking. So the general applicability date and then the dates by which the EHI is limited to the data elements represented in US CDI. Next slide. And as Mike mentioned, in the ONC Cures Act final rule, we found a number or some errors that we made in the rule that we determined were worthy of correction or clarification. So we included those in this interim final rule. Next slide. For example, because Part 171 defines information and provides a series of exceptions, it was more appropriate to say that actors are subject to the provisions rather than must comply with. So we made that clarification in the interim final rule. We also clarified that a number of phrases within the rule to avoid duplication. We clarified that developers subject to the information blocking provisions are health IT developers of certified health IT. We also clarified that an actor will fulfill a request, not fulfill a response. And in addition, we corrected some typographical errors that were in cross-references included in the ONC Cures Act final rule. And now I will turn it over to Rob Anthony to go over the certification.
Thank you, Kate. I will go immediately to the next slide. Wanted to remind people about conditions and maintenance of certification. A lot of the changes that you will see in this IFR are related to changes in compliance deadlines for a number of things that are required within the condition of certification. And before I sort of talk generally about that, I just wanted to remind people conditions and maintenance of certification are new requirements on health IT developers who certify products within ONC's health IT certification program. They are around these 7 conditions. We implemented 6 of them within the Cures Act final rule. You're going to see that a lot of the compliance deadlines that we have extended in this area are related to those conditions and maintenance of certification requirements. Next slide. Primarily, I did want to emphasize here that what you are seeing, and a big portion of what is in the reg here, is both information blocking and an extension of compliance deadlines. This is not a delay of certification. A lot of the update requirements that are put into place because of the Cures Act final rule and a lot of the certification criteria and standards that can be updated can actually be updated right now, today. They are available and there are test procedures and developers can go through that process. But what we have provided for are extension of the deadlines by which a developer must comply with those various deadlines. So essentially, giving additional time to complete the certification process. So what I'm going to talk about here are primarily things that are related to health IT developers of certified health IT. They are related to the Cures Update certification criteria and to the conditions of maintenance of certification requirements. Next slide. And I think you're going to see two dates here. You will see this April 5th, 2021 date, and that is the same date as you will see on the information blocking timeline. We did align very much the conditions around that information blocking timeline. First of all, you'll see here the condition of certification for information blocking, which essentially says that a health IT developer may not engage in information blocking. We aligned to the overall information blocking compliances, and many of the other conditions of certification are tied to that same April 5th, 2021 date. So you will see that a number of these here are all tied to the April 5th, 2021 date. Assurances is a category, a new condition and maintenance of certification requirements in which a developer assures that they're not going to take actions that constitute information blocking. You will see in this third line, the 402A2 and A3 are about developers ensuring that their products comply to the full scope of their certification criteria and that they won't take any action to interfere with users' ability to access that certification criteria. All of that delayed onset requirement until April 5th, 2021. Similarly, with communications, we did move most of the requirements around how a developer may speak and what things they may prohibit or restrict communications around their health IT into April 5th, 2021, and also delayed the notice requirement for 2020. And finally, there is an overall compliance for API criteria, and this B4 refers specifically to conditions for existing APIs within existing products, and it imposes some requirements for health IT developers around transparency requirements, what fees are permitted, openness, pro-competitive conditions. And again, the onset of those requirements will be April 5th, 2021. Next slide. So the other date that you will see here is December 31st. And in this case, both 2022 and 2023, we moved many of the requirements for updates for specific certification criteria to a December 31st onset date. Most of those, which were originally 24 months after the final rule, have been moved to December 31st of 2022. There is an update requirement for a new API functionality that is Fire-based G10. That is what this first line refers to. That has been moved to a compliance deadline of December 31st, 2022. Similarly, there are a number of other criteria that update, and the reason that we list them in real-world testing is because from a regulatory perspective, that is where many of those updates are listed. I will cover those briefly on the next slide, but December 31st, 2022 for those as well. The outlier for certification criteria update is the update for the new EHI export functionality, the bulk export functionality, or B10, which had originally been 36 months after the publication of the final rule, and that has been moved to December 31st of 2023. And we specifically aligned towards the December 31st deadline in order to provide maximum flexibility for providers in the following year who are using a new version or an updated version of that certified EHR or health IT technology with CMS meaningful use program. So we definitely considered that as we extended these compliance deadlines. Next slide. There are a number of things that move essentially 1 year later because so many of the other conditions and maintenance of certification criteria and other criteria have moved as well. So there are things related to communications. I think I mentioned this before. The notifying all customers was supposed to begin annually in this year, and we are moving it to an annual cycle beginning in 2021. The initial attestations, there is an attestation requirement that a developer has met all of the conditions and maintenance of certification requirements. Originally, we were going to open that first attestation window on April 1st of next year, but that will be moved 1 year later to April 1st of 2022, again, to account for all of the other areas where the extension of compliance deadlines have happened. And then finally, real-world testing. The initial real-world testing year was going to be 2021, with initial plans to be submitted December 15th of this year. And we have moved that an entire year. So now the initial real-world testing year will be 2022. Your initial plans for developers would be due by December 15th of 2021, with, of course, initial results from real-world testing following the 2022 year in March 15th of 2023. So everything in this area moved 1 year later to account for some of the other extended compliance deadlines. Next slide. And then finally, this is what I mentioned earlier. There are a number of certification criteria that update. Either they update in functionality or they update a standard or both. And all of those have moved their compliance deadline to December 31st of 2022. You will see this for the requirement to apply to the new U.S. Core for Data Interoperability Standard, which is a replacement for the CCDS, the Core Clinical Data Set that was originally used. And you can see it affects the following criteria. That has been extended to December 31st, 2022, but of course, developers could certify to that now. It is available. Similarly, there are a number of new and revised certification criteria that are listed here. And for those who don't know our regulatory shorthand, you can reference the certification companion guides that we do have in the certification section on our website on healthit.gov, and they will tell you what each of these are. But things like B3 is e-prescribing, C3 is related to electronic clinical quality measures, and most of the D criteria are related to privacy and security. You will see a number of standards that have been updated in these areas and required to update to these standards for developers by December 31st of 2022. But again, these are available to be certified to right now. So it is not a delay in onset, it is an extension of the compliance deadline. Next slide. So this is a timeline overall, what certification looks like. Obviously, a lot of different things that are happening here, but I would urge people to sort of zero in on a couple of the dates. The April 5th of 2021 date is the onset of most of the conditions of certification requirements. The onset in December 31st of 2022 for most of the certification criteria updates. We have real-world test plans in December of 2021, and we have the EHI export capability, the B10 criteria, by December 31st of 2023. Next slide. There were a number of updates that we made that were essentially corrections for different in the rule. These were by and large fairly minor or done by necessity. Next slide. There was an update to the U.S. Core Data for Interoperability Standard. For those of you who are familiar with this, we published a July 2020 errata to address a number of stakeholder concerns about some unexpected or unintended changes that were made. They were not to delve into too much detail, but we had inadvertently imposed some requirements related to loink and snowbed in some places that we removed. Similarly, some things related to the unified code for units of measure in a couple of different areas. Again, not a significant change, really done this errata to make it clear that it wasn't meant to impose an additional standard of burden above the initial CCDS requirements. And we adopted that officially by reference, incorporated by reference, the July 2020 errata through this IFC. Next slide. Similarly, we adopted the newest version of HL7's FHIR US Core Implementation Guide. There were a number of technical issues and a bunch of copy paste errors and omissions and minor clarifications that the health IT standards community identified, and HL7 released this updated US Core 3.1.1 guide, which actually makes a number of corrections that are necessary to implement the US Core IG. So we adopted by reference the 3.1.1 implementation guide here. Next slide. And then these are the corrections and clarifications that you will find for a number of the certification criteria. If we go to the next slide, you'll see that some of these are some very simple nomenclature changes. We inadvertently referred to health IT modules in a couple of places where we meant health information technology generally. There were some adoptions of the latest ASTM standard in privacy and security sections. The previous ASTM standard had actually been deprecated by ASTM, so we have referenced the newest standard and under that, the newest network time protocol with that. Corrected an error related to clinical quality measures about the time period in which a health IT developer has to comply with update to the latest CMS implementation guide, a nomenclature error in D13 related to privacy and security. I think in F5 for public health reporting, we inadvertently adopted the CCDA standard here for support, and that had not previously been a requirement. We actually didn't propose it. We adopted it erroneously, so we removed that requirement. And then a clarification here about a timeline for maintaining refresh tokens related to the new API requirement in G10. Again, all very minor corrections and clarifications, most of them just inadvertent errors that we corrected in this final rule. Next. And then I believe I will turn this back over to you, Mike, to close us out.
Yep. Thank you, Rob. I know this wasn't a long presentation, but we thought it was still important to have a summary and go over the important key points made by my colleagues, as well as talk a little bit about the resources we have available to you. So obviously the most important point for the broad stakeholder group, particularly ones covered by information blocking, is that, as you see here on the screen, the applicability date moves from today to April 5th. So that is an additional 5 months and a few days to focus again on the COVID-19 public health emergency, while also planning how you will comply, if you're not already in compliance, with the information blocking requirements. As Rob went through for you one by one, many of the other provisions in the program have been pushed back at least to December 31st, 2022, and some past that, but consistent with our final rule policies. One thing worth mentioning again and emphasizing is that this when this rule does publish, like I noted to you earlier on Wednesday, the info blocking provisions will be effective immediately, and the related info blocking provisions found in the conditions of certification requirement. So that simply means that there isn't a delay. There's normally a 30-day delay before provisions become effective, but we put forth a waiver for that so they can become effective immediately. So there isn't a period of time where folks aren't sure is, wait, are they exercising enforcement discretion for the next 30 days? Do I have to comply? So the answer is there is both enforcement discretion for these past period of time, and now the date itself has actually been moved through this rulemaking. The last piece I wanted to mention is that there's a 60-day comment period, but that again does not mean that these provisions aren't effective immediately or within after the 30-day delay. So while we are accepting comment on this rule, the provisions are technically final, as it is an interim final rule, and will be effective on Wednesday. and then 30 days after that for some of the more minor clarification provisions. Let's move to the next slide. So what you have here is a combo, and you may have of the two timelines that were discussed by my colleagues. So this puts the certification and information blocking dates together. So the information blocking dates are on the bottom, as you can see, and the certification dates on the top. And this is a helpful tool, we think, for those health IT developers who have certified health IT, because they must comply both with the certification requirements, but also covered under information blocking. And it's also a helpful tool for those providers who adopt certified health IT, so they can see the expectations in terms of when their developers need to provide certain functionality by, but also keeping in mind that information blocking applies to them as well. And that's true even if you don't adopt certified health IT. So the definition of healthcare provider is broad, includes labs, includes long-term post-acute care providers. So those that aren't even participating in the Promoting Interoperability program. And let's move to the next slide, because I can talk a little bit more about resources like the one you just saw there on your screen. So that particular slide we just were talking about is available on healthit.gov/cures rule. Those other two slides that focus just on info blocking and on the certification program are also available. So depending on how the rules apply to you, you can pick the right educational resource. And that's going to be something that we can continue to do. So both the interim final rule, you'll be able to find there if you really want to dig in and read it. It will be updated to have a link to the published version as well as a display version that's currently available on the Federal Register. And then there are fact sheets. And then going back to the point I made about, how does it apply to me, so to speak, we have a fact sheet just on info blocking and for this interim final rule. So if you're a provider and like I said, you're a lab and you don't participate in the Promoting Interoperability program or use certified health IT, you can go right to that fact sheet to understand how this interim final rule applies to you. And then there are other resources for those that maybe use certified health IT as well. And we're going to continue to update those resources, like I said, based on how this rule affects you as a stakeholder. And on that point, I'm happy to announce that today our frequently asked questions have gone live. So this is just a start to the process. We have 9 FAQs that are now up on our website, and we will continually add to those FAQs from today going forward. And hopefully it'll be a robust set of FAQs by next year in the applicability date. And not to mention, there is a health IT feedback portal. Do we have that? Maybe it's on the next slide. I think it's on our last slide. There's the actual link on the contact ONC. And that allows you to submit questions about the rule to us, and then we respond directly to you. And so we've been doing that as well as putting together these frequently asked questions. And another piece of our planned stakeholder outreach is to continue to give discrete presentations to stakeholder groups. So we've been trying to do that for developers of certified health IT, to their customers, to associations, to various health IT trade associations as well, to individual representative patient groups. And we're going to continue to do that. We have a robust planned educational outreach, and we've been conducting that actually since the rule went final. The last thing I wanted to remind you of, besides all that various educational resources in today's webinar, we have multiple recorded sessions of prior webinars on the final rule available on our website. So going back to healthit.gov /cures rule. So there's one just on information blocking with slides. And I think that runs like maybe over about 1:15 to an hour and a half. We have one on a Q&A where we answered questions live. And then we have some just on the program itself that Rob was, telling you some of the changes to the program. So if you want to know what was first finalized, you can go and listen to that presentation. And then we have one, just an overview on both parts of the rule, both the certification part as well as information blocking. And to that Q&A one, that may be something we will entertain in the future, doing another Q&A one. But right now we're focusing on those three things I mentioned to you: answering direct questions that come in through the Health IT feedback form, putting together frequently asked questions, and trying to do stakeholder outreach presentations as well. So we are keeping our plate full, hoping to reach out to all stakeholders covered by this rule, because I think what we've heard back is there are providers that don't understand the implication of this rule or that it even applies to them. And that's something that we want to make sure we're getting out and educating those stakeholders about the rule and its effects on them and its implications for improving care and access to electronic health information. Okay, I think that wraps it up. Hopefully this gave you a good overview and even some specificity as to what's in our interim final rule. And again, it will be published on Wednesday, and that starts the comment period. So 60 days to provide any comment you would like on the provisions in the rule. So I want to be clear about that. It's a comment period for the provisions in the interim final rule. So thank you, and look forward to engaging you in the future on this rulemaking. Bye.